Hey everyone, my name's Tony Mennito. I'm a general dentist in Charleston, South Carolina, and I wanted to spend a little bit of time talking about kind of what I do day to day. I have a little bit of a different career path that I've taken. So you'll see that part of my week is spent doing academic dentistry, and part of it is here at my private practice. It's actually my private practice. I'm an associate here 2 days a week, and you can see in the background that I like to do digital dentistry, and that's going to be a real theme of the next 45 minutes or however long this video lasts, is talking about how I came to do dentistry the way that I do it and why I believe it's such a better way than I was taught. I went to dental school at Temple, had a very good education, graduated in 2003 though, and a lot has changed since then, and the technology that we have, and a lot of things that we know and have learned since that time that we can put towards doing dentistry a certain way. And I like to call it conservative dentistry, meaning that if you have a tooth that's broken down, basically you've got parts of the tooth that are healthy, and you have parts of the tooth that are either a filling or some other construct that a dentist has made, and then a cavity or a part of the tooth that's broken or whatever. So you have the good stuff and you've got the bad stuff. In conservative dentistry, the mindset is you keep all or as much of the good stuff as you possibly can while just focusing on fixing the bad stuff. Right? It makes a lot of sense, but in dentistry we often do things to achieve something called convenience form or resistance and retention form, these forms that you'll learn in dental school. When with modern technology and techniques and great dental materials, you really don't need to do that anymore. So that's going to be kind of the big picture of what I'm going to talk about. That's my focus. It's not the only way to do dentistry, but I think for me it makes the most sense in my brain, and that's the way that we like to do things. And part of that equation is that technology that you see behind me. That pink thing is a milling machine. It is able to make crowns, inlays, onlays, all types of dental restorations here in the office. It takes about 10 minutes for that thing to mill out the shape of the replacement restoration. And then that little fella next to it is a sintering oven, basically a like a kiln, right? If you do pottery, you have something that needs to be fired, heated to a very high temperature, and that is what that does. And not to get too much into the weeds of dental materials and the stuff that we use, but it's very cool. We have a great set of materials that we have at our disposal, and are able to produce restorations, fillings, crowns, veneers, all those things for patients that last a very long time. So I'm excited to share a little bit of my journey with you. When I'm not in practice, I'm here at the James B. Edwards College of Dental Medicine, where I teach in the CAD/CAM clinics. Right now, it's pretty dead. All our students are hopefully with their families getting ready for the holidays, but I love my time here. I love teaching. I think it's a great way to kind of mix up the week. And the really fun part of teaching here is I get to teach a lot of the technology that I get to use in practice. So all that, the mills and the ovens that you saw in my practice, is the same stuff that I teach here. So very much focused on that. I think it's great because that's definitely where our profession is heading. And I think it's giving our students a big advantage being taught that now versus having to learn that stuff after they graduate, like I did. One of the other things I get to do is a lot of 3D printing, and I'm currently working on a grant that I got, trying to improve the way that we teach dental students. So right now we use plastic teeth, and they're all the same material. Teeth are multi-layered. They have different feels whether you're working in the enamel or the dentin. So this project is trying to find a way to mimic that with what we call a typodont tooth, or a plastic tooth, basically using different types of 3D printable resins. And so this is what I've been working on kind of over my break, and this is kind of a cool part. But 3D printing is so messy. So it's you can see this is kind of trash, but we have a lot of cool 3D printers. We actually even have from Italy a metal 3D printer where we can print parts of dentures and things like that. So we have a lot of abilities here at the university. This is actually one of the only, I think there's two metal printers by this company in the United States right now. We have one of them, so that's pretty cool.
So that's just a little bit about kind of my day to day. I did want to kind of come up with a disclaimer, and you may have already noticed that uh, I've been a dentist for a while, and we have our own language in dentistry, and I will try to keep this as understandable, easily understandable for you as I can. But sometimes I slip into that language simply because that is what I do all day, every day, talking about dentistry in the language of dentists. So. I'm going to try to keep this as easy for you to understand as I can, but if I slip occasionally and use a term, I've already used the term dentin and enamel, just in case you don't know, those are kind of the two main layers of any given tooth. We all know enamel, right? The hard outer covering, the part of the teeth that we can see in most cases is covered in enamel, and then below that is the dentin. The dentin is softer. It communicates with the nerve of the tooth, which uh, is important. And so, yeah, I will try to keep it as easy for you to understand as I can. I call this a career you can love because I absolutely love my job. I love everything about it. I am a true dental nerd. I could literally sit and talk about teeth with my dental buddies for hours, and we often do. So it is um, definitely the career that chose me, and I'm very happy uh, to be in this career. I think it's fantastic. If you are thinking about becoming a dentist, there are some major things that we'll talk about during this that are things you should consider. So we'll kind of talk about that a little bit. But as you noticed, I do spend my time between a private practice and a dental school, and I want to talk to you a little bit about kind of the way things have changed over the course of my career. I talked about the fact that I graduated in 2003, and most of what I learned, man, a vast majority of what I learn, I don't use anymore in practice, which is hard to believe. The part that I learned that I use every day is the ability to work with my hands. I think that's a really important part of being a dentist. You learn how to use a drill, right? If you've been to the dentist and you've had a cavity, you know all about the drill. The drill is one of many parts of a dental procedure that patients don't really like. Having that thing kind of rattling around in their mouth, in their head, is not a favorite of our dental patients, but it is a necessary evil, unfortunately. The other thing is amalgam. I learned all about amalgam, and for whatever you have heard or have learned about amalgam, there are certain facts that are undeniable about amalgam, and that is they saved millions of teeth over the course of 100 plus years. It was a great filling material for us for a very long time, but its time has passed. The main thing about amalgam that is bad is the fact that it contains mercury. Mercury, while yes, it is poisonous. The bigger issue, because amalgams in and of themselves, and much research has been done to prove this. When you place a silver filling, an amalgam filling in a patient's mouth, that mercury is tied up within that filling and is not exposing that patient to higher mercury levels. So the danger with these mercury containing fillings is not to the patient, it's actually to the environment, because there are difficulties with getting rid of these materials, either the part of the material that you don't use, or when you're taking these old fillings out of people's teeth. How do you dispose of that mercury containing metal? And that has become a real big environmental problem. I already talked to you about research, and one of the things that we teach at the university is something called evidence-based dentistry. And this is the way that all healthcare nowadays is taught, And basically, that is, I am not going to stand up in front of the classroom and give you my opinion. I'm going to teach you what research and what the evidence says on whatever topic. So what I've just told you about amalgam is not my opinion. It's not something I read in an on or saw on a television show. This is based on research that has been done, many millions of dollars worth of research on this particular topic. And that's the way we teach dentistry. It's all evidence based. You will see in many avenues, social media in particular, where a lot of people will put their opinions. And their opinions might be worth something, but they also might be totally counter to what the evidence says. So it's just a very interesting time for us in dental education. I feel like our students oftentimes will come to me and say, "Hey, Dr. Mennito, I saw this and this on Instagram. What do you think about that?" And once again, that's not the way we teach. We teach evidence-based dentistry. I think that's the best way to make sure that what you are doing for your patients is going to be a proven method with proven techniques to get the best results for them. And that's one thing that I can't stress is that when you become a dentist, uh, it is all about the work that you do for your patients, right? And trying to do dentistry that will last as long as possible. And that's really what we're focused on, doing really great dentistry that will enable our patients to keep their teeth in their mouth until the end of their lives, right? That is as I see it, that is my job as a dentist. If a patient comes to me at the age of 15 and they're going to see me for the rest of their life, my job is to keep their teeth in their mouth for that entire span, right? So helping them not only when they have problems, but also teaching them how to take care of their teeth, getting on them maybe a little bit if they're not doing a good job. We talk all the time about patients. Our patients, to be quite honest, don't love to floss. And so we talk quite frequently about trying to motivate our patients to take better care of their teeth. And so I think that's a big part of being a dentist as well. So yeah, we don't really use these silver fillings much anymore. What we have switched to is something called composite resin. And composite resin is basically a tooth colored filling. So it is more aesthetic. All right. Aesthetic is a word that basically means pretty. All right. We use that term all the time: aesthetic dentistry, cosmetic dentistry. Basically, we are trying to use materials nowadays that blend in much better with the tooth. And so when you look at this filling that you're seeing right now, you can see the old filling, but you can kind of make out the edges of the old filling because it's kind of rough. You can see that tooth also has a cavity, as I've outlined for you. And then you can see after taking out all that old filling and that cavity, we were left with some tooth structure, enough tooth structure to be able to just do a filling. And in this case, I used this composite resin material and bonded that into the tooth to restore this tooth. And this is a reasonable expectation for this filling would be 10 plus years, depending on how well the patient takes care of it. So that is the goal. Hopefully we get even longer than that, but hopefully we get 10 plus years. This is considered a relatively large filling, I think. And so the next step for this tooth, once this filling fails, and once again, hopefully 10 plus years, would be something that helps to reinforce the tooth a little bit more than this filling does. Now you can see there are some what I call anatomy in this tooth, and that is trying to make my filling look like the tooth looked back before it had a filling at all. So trying to add those little anatomical features into the tooth, I think, is an important thing. I like to make teeth look like teeth, and that's part of this cosmetic dentistry, or just trying to do more aesthetic dentistry. Now, one thing that I cannot stress enough to you is that your time in dental school is not about just learning how to do dentistry pretty good. It's about learning how to do dentistry as well as you can. So it takes a lot of practice. It's like this artist. This artist did not become this good at drawing by doing one picture, right? By drawing one set of eyes or lips or a nose. No, it takes many, many repetitions to get skilled enough to do something that is this realistic. And the same holds true for dentistry. So oftentimes I get frustrated with our students because they come to me and they've done a project and they managed to do it well once. And I say, all right, well, go do it again. And then after you've done it again, do it again. And basically the idea is that you don't want to do it until you get it right. You want to do it until you can't get it wrong, till you can do it that way every single time. And I like this quote. This is one of my favorite quotes. There are no secrets to success. It is the result of preparation, hard work, and learning from failure. And there will be many times when you bring your work up, and maybe you've experienced this already in your lives, where you will bring a project up to me in our simulation lab, and you'll show me a tooth that you have worked on, and I'll say something like, you know, this needs a little bit of work, and I'll point out what's wrong with it, and then I'll ask you to do it again, starting over from scratch. And oftentimes I get a lot of frustrated looks from our students. And the reality is, you have to learn from that failure. There is nobody who is born with the innate ability to do dentistry. All right, it's something that you have to learn from scratch, and that takes a lot of learning from failure, basically, and a lot of hard work. So I think that's one thing that I would encourage you, once you do get into dental school, to take that approach, that you are going to use those 4 years to become as proficient as you can at the art of dentistry, and that is working with your hands. It's all those being able to manipulate that handpiece to create the shapes that we ask you to create. I think that's a pretty important thing. So now I want to talk about a little bit more about this dental aesthetics. And I'm a big fan of photography. And the one thing, and I didn't own a camera when I was in dental school. I never took any pictures of my work until probably 7 or 8 years after I graduated. But I think almost as much as anything in my career, purchasing a camera has really helped me to raise the level of my dentistry. And I'll talk to you about that. I mean, for one thing, you saw that picture of the composite resin filling that I did. Being able to photograph your work and to see it on a big screen like we're able to really helps you to see what you did well and what still needs a little bit of work. And I think that more than anything, to be able to appreciate really the details of what you're doing is a very, very important aspect of improving as a dentist. So anytime our students come to me now and they ask me if I think it's a good idea for them to purchase a camera to take pictures of their work, I tell them absolutely 100%, because I think being able to photograph your work and to see the good things and the bad things blown up on a big screen is incredibly valuable. I enjoy taking portraits as well. This is a portrait that I took of just a friend of a friend who came in one afternoon and modeled for us. We just tried to get a little bit creative, and I think that's the one thing about dentistry that I didn't realize I would enjoy so much, is the artistic side of it. And so while yes, it is incredibly important to think through the science of the materials that we use, there's a lot of chemistry, a lot of organic chemistry, there's a lot of biology, obviously, and physiology, and all that basic science stuff that is incredibly important to be a good dentist. But there's also the artsy side of things, and that is especially important nowadays with the cosmetic dental revolution that we've kind of undertaken in the last 15 or 20 years. And so, and it's something that I really, really enjoy. So once again, using that same camera that I use to take photos of my work intraoral, right? So inside the patient's mouth, to also take portraits and to try to get a little creative. And so I wanted to talk to you a little bit about kind of some of the things that we look for when we're looking at a smile. And this is maybe something you've never really thought about. And when you look at somebody and you think, oh, that person's got a really nice smile, what exactly about their smile is it that you think is nice? And I bet you've never really thought about that other than, oh, their teeth are white and straight, right? So white and straight tends to be kind of the two places where we start when we look at somebody's smile, but there's really a lot more to it. And there are some aspects of this that have been researched. And so we can look at that in the evidence-based dentistry, right? And try to figure out what aspects of a smile most people find appealing. But the reality is that everybody's different. And some things that you may like, I may not like, and vice versa. So it's just really interesting. But one of the things that we look at first and foremost is symmetry. And this is a picture of a fellow dentist that I met. She is from the Midwest. Her name's Abby. And you can see it. I think Abby's got a great smile. So not a perfect smile, but a very natural smile. And the first thing we look at is if you think about a piece of art and you buy a piece of art, what is the first thing that you have to make sure that that art has? And it's a frame, okay? Every piece of art needs a frame. And for the smile, all right, the frame of that are the lips. So we look at not just the teeth, we look at the gums, all right, we would call that the gingiva, and we look at the lips as well, because the lips end up being the frame for the smile. All right, even stepping outside that a little further, we're also looking at the facial features, and we're thinking about symmetry from as a relationship to different planes of the face. So if we draw a line between the pupils, the interpupillary line, and we also draw another line between the corners of the mouth as the patient smiles, you can see those ought to be relatively parallel. All right, the other line we need to know about is the midline of the face, and that should be perfectly perpendicular to those other two lines that we just drew. Now, hopefully, when you draw this midline of the face, it goes and it bisects right in between those two front teeth. Okay, those two front teeth are called the central incisors. And in an ideal situation, as Abby has here, we would have two horizontal parallel lines and one vertical line that at perfect 90-degree angle bisects the face and goes right through the dental midline through those two central incisors. Okay. The other thing we need to look at are where are the edges of those front teeth. So the edges, meaning the kind of the sharp edges that you would use to bite into a piece of pizza. We call those the incisal edges. Where do those fall as a relationship to the lips? And so we would often draw a line kind of like a U, kind of like a smiley face line along that lower lip. And ideally, the edges of those front teeth would follow that lower lip line. Okay, these are all things that are generally considered aesthetic or cosmetic in regards to a smile. So it's not as simple as white and straight. We have to look at the relationship of the smile to the lips and the smile to the rest of the face. That's an important part. Stepping back just a little bit, a lot of people refer to the front teeth as the social six. And this was kind of a joke back in the day when we would talk about people would come in and they weren't happy with their smile. And so we would do 6 restorations of some sort to make those teeth look a little bit more aesthetic, to make their smile look nicer. And when there's a lot of problems with that, but I just want to talk to you in terms of the social six and what can go wrong in a person's smile to begin. And then we'll talk about what is wrong with the idea of the social six. So when patients come to us, they often and they talk about the fact that they're not happy with their smile. Some of the more common issues are one, discoloration. Okay, this is something that happens in all of us over time. Our teeth discolor. All right, the more we age, the darker these teeth get. That's part of the natural aging process. There are simple procedures that we can do either in our dental offices or that we can make for patients to take home with them to whiten those teeth. So that's not a very big issue. Generally, that's easily fixable. Sometimes patients come to us and they're not happy about the arrangement of their teeth. Okay, so their teeth are crooked or they're overlapped. And so this is something that also is relatively easily fixable, especially nowadays with the advent of something called clear aligners. I personally use a product called Invisalign in my practice. These are clear aligners that you can wear that are discreet, so most people wouldn't notice that you're wearing them to help rectify a situation like this where teeth are overlapped or crooked or oriented in less than an ideal way. By the way, on that note, something like Smile Direct Club, which is a what we call a direct-to-consumer version of Invisalign, where basically no dentist is following your treatment. They just kind of give you all the stuff to do it at home. Just a quick word on that. I would steer clear. We've seen quite a few issues with that. Patients who come in mid-treatment and are having issues like the teeth are being moved out of the bone and things like that. So not a good idea to do that sort of tooth movement without having a licensed dentist kind of watching to make sure everything is going to turn out okay. So I like the idea of direct to consumer for some things, maybe not orthodontics. The other thing that we see an awful lot with the social six are patients who come in and their teeth are quite a bit shorter than they used to. So once again, in the process of aging, we use our teeth every day, right? Every day, multiple times a day. Chewing is the main function that we use our teeth for, obviously. Some people use their teeth for appropriate things. Some people use them for inappropriate things. I saw a video of some college girl taking off the tops of beer bottles with her teeth, and obviously that is not a great idea. But over time, the teeth do wear down and they become shorter. And as they become shorter, when you smile, you see less and less teeth, and this is thought of as being non-aesthetic. It's also kind of a sign of aging. So when you smile, the more teeth you show to a certain extent, it's thought of to be a little bit more aesthetic and youthful. So we get patients who come in a lot with worn teeth who just want to be able to see their more of their teeth when they smile to have that more youthful look. So as we go back to Abby and we talk about the social six, if you count where the front six teeth are, you can see those aren't the only teeth that she shows, right? She shows quite a bit more than that. So if we were to kind of artificially whiten just those front six teeth and just ignore the teeth behind it, so there on each side there are two additional teeth that you would see when she smiles, you would probably have some problems. And we've seen cases over the years where patients go in and the dentist does maybe six veneers and they lighten the teeth significantly, but behind those six teeth, all right, in the premolar area, the area just beyond that, those pointy teeth, which are called the canines, um, they're still dark and they don't blend in well. So it doesn't make for a very pretty outcome when you only work on the teeth, well, those six front teeth. Oftentimes, when we do veneers or any cosmetic work, you basically have to look at what the patient shows when they smile, and generally it's at least eight teeth, sometimes 10. So just something to keep in mind. And if we zoom in even closer on Abby's teeth, one of the things that I really want you to notice about her teeth is one, are all the different kind of shapes, right, of each teeth. And if you look really carefully, teeth aren't, especially the front teeth, aren't really flat. There are kind of planes to them. There's curves. There's anatomy there that you probably wouldn't have ever appreciated if you had never seen a picture like this up close. If you look at her lower front teeth, can you see how the edges are kind of gray? And that's, I think, something that's a trademark of natural looking teeth. We talked before about enamel and dentin and the two layers of a tooth. Well, that's actually what you're seeing in those teeth. The enamel portion of the tooth is actually translucent, meaning light can travel through it. Okay. The dentin part is more opaque, meaning it doesn't allow light to travel through. So that grayness that you're seeing is actually areas of the tooth where there is no dentin to reflect that light back to us as the viewer. So the light goes all the way through the enamel to the back of the mouth, which is obviously dark. And so that's why we're seeing that little bit of gray on those lower teeth. And I think that's actually, for me as a student of dental anatomy, I think that is a really neat feature that makes teeth look really natural. And if you look at her front teeth, you can see that on the top, the two central incisors, you can get just a little hint of that grayness just starting to peek through, but not as much as you can on those lower teeth. Now, why do we talk about this and why is it so important? Well, it's because people will come to you all the time with teeth that are broken down, and front teeth are very commonly broken. They're right out in the front, right? So if you, as a child or as an adult, fall, all right, and you fall face first, right, what's going to be the first thing that hits? It's going to be those front teeth. So these front teeth often get broken from one thing or another, all right? When I was younger, played a lot of basketball, and I have two teeth in my mouth that have chips in them from getting elbowed. So, playing basketball, elbows get thrown, and all of a sudden you lose a little piece of your tooth. That happens all the time, and so patients will come into you and they want you to fix it. And this is a an example of a fix that wasn't done very well. It's obvious where the filling was. And so the idea of learning anatomy of teeth and about the different colors and translucencies of teeth is so that when a patient comes like that, you have the skill set to be able to put them back together in a way that's not going to be noticeable by people, right, who might happen to see that person smile. So here's an example. I call this the dentist is a patient because working in a dental school, I obviously work with a bunch of other dentists. And so it was lunchtime one day when this dentist came to me and he said, "Hey, Dr. Mennito, my filling came out. He had had a filling done in this tooth, and you can see that tooth has, part of it that's missing." And he said, "Can you fix it for me? This is something that I do, I think, pretty well." And so I did over the course of took me about 45 minutes to get him put back together. And this is that tooth now. And the whole idea is that when you look at this tooth, all right, it looks a whole lot like the tooth next to it. All right, it fits in. It's kind of camouflage, right? If you look really, really carefully and you know what you're looking for, you might be able to tell if there's a filling there. But for the most part, that is, I think, pretty well done. And actually, I did this a couple years ago, and obviously see them, and it's still in place, despite the fact that people use these front teeth for a lot of tearing, right? If you think about when you bite into a sandwich or a piece of pizza or something like that, and the amount of stress you put on those teeth, you probably don't think too much about that. But one of the big difficulties with putting a filling on a tooth like this is that a lot of times they don't hold up very well under those types of stress, right? Biting fingernails, opening beer bottles, things like that can all cause these fillings to fall off prematurely, as the previous filling that he had done. So once again, it's all about knowing about the materials that we use, the best ways to use them, and then being able to execute with a little bit of an artistic ability to see colors, to see shapes, and to reproduce those in a patient's mouth. Right. So this is kind of basic cosmetic dentistry. Now, the one thing that I like to talk about a lot is how everyone's idea of what is pretty is different. So, what looks good to some may not look good to all. And so, straight and white, if you look at that top picture, straight and white, this definitely fits the bill for straight and white. But for me, that doesn't at all look natural. So, my own bias and my own opinion is that that smile on top is not as pretty, it's not as natural as a smile on the bottom. Both of these are veneer cases. And so it's just a matter of what your opinion is. Some people really like bright white and straight teeth, and that's okay. There's nothing wrong with that. It's just a matter of kind of what you think looks pretty. And so I want to show you a case that we did because I personally am all about when we do aesthetic dentistry, doing it to look natural and to blend in. So we talked about the social six. Here, we only really had four teeth that were kind of having some issues that we wanted to treat. And the main issue was this front tooth that had had a crown on it for like 40 years. So this was a good example of this patient had fallen off their bike when they were younger, many years ago, had broken that tooth, and the dentist had put a crown on it. Well, that crown looked nice for a long time, but it doesn't anymore. And so it's time to refresh that. Now, the one thing that we notice is that you have a couple other teeth that are maybe a little banged up, okay? And there were some small cavities on these teeth as well, but for the most part, two out of the four of these teeth are in really, really good shape. So and you'll see here in a minute how much tooth structure has to be taken away to prepare the tooth to do a crown. It's a lot of tooth structure that we have to take away. So when we talk about being conservative and doing more conservative dentistry, this is a good example of some of the things that we'll do. Instead of doing crowns on these teeth, we're going to do very conservative veneer preparations. Now, I'm sure you've heard the term veneer. People talk about veneers a lot. But do you know what it is? So a veneer, it means that you're just putting something on the front surfaces of those teeth, and basically they're going to cover just the part of the tooth that people can see. And you'll have a little bit better understanding of that as we go through this case. But one of the things that I do, being a lover of digital dentistry, is I do something called the digital wax up. So we would take a three-dimensional scan of this patient. So I don't use that goop. A lot of you have probably had maybe orthodontics done, and you've had to have an impression taken, right? And they take that tray and they put stuff in it, this kind of either putty or kind of goopy stuff. They put it in your mouth and it sets up around your teeth and it makes a mold of your teeth. Okay, there's a much more modern way to do that, and that's the way I prefer to do it. So we would take an impression to get a three-dimensional model of the patient's teeth, and then I can manipulate that to basically change the shapes of the teeth to make them look how we want. We call this a digital wax up. We take that digital wax up and we would 3D print it on one of our 3D printers, and we would take a mold of it. All right, and this mold is very important because basically we can put this into our patient's mouth to transfer the shapes, the new shapes of these teeth, all right, into the patient's mouth so that they can see what that wax up will look like actually in their mouth. And so we call this a trial smile. We also will use this putty for making our temporary restorations when the time comes to actually do the case. So this might give you a little bit better idea of the difference between a crown and a veneer preparation. So when we prepare a tooth, we take away a little bit of tooth structure, we create a very precise shape, okay? And you can see how much tooth structure was taken away to do this crown versus these veneers. Now, we haven't touched the backside of these veneer teeth at all. So all the work that we're doing is done kind of in between the teeth and very minimally on the front side. And all we're doing is creating a little bit of space so that we have room for our pretty ceramic veneers, okay? Obviously, this tooth had already had a crown on it before, so we had to do the same thing. Can't add tooth structure back, and that's an important point. Once you take a tooth structure away, there is no getting it back. So we have three veneers, one crown prep, and our canines we're going to try to match. So this patient has some very interesting looking, and this is pretty common, some white, all right, on their teeth, and their teeth are a certain color. So we need to make sure that when we do our final veneers and crowns, that they match these natural teeth. One of the things that we had this patient do was we had them whiten their teeth. to brighten up the smile a little bit before we did this case. Once we prepared the teeth, then we make temporaries because we have to send uh, these models off to the laboratory and have the laboratory make these ceramic veneers and crowns for us. And so you can see the temporaries blend in very well. And so one of the things that we use our temporaries for is to make sure that the patient's going to be happy with the shapes and the color of these teeth. The other thing we need to make sure is that the patient will be able to speak correctly, that they'll be able to, or that they won't crush these temporaries, because these temporaries are basically made out of plastic, that they won't crush these temporaries, and so that the restorations fit into the scheme of their bite and things like that. So the temporaries are actually very important information for us, and how they hold up over the course of 3 to 4 weeks will tell us a lot about how our veneers and crowns might hold up. What we also do at that appointment is we take another digital impression. So like I said, we don't use a tray like this where we put goop in. Instead, we use a digital scanner, and we will take a digital impression of that patient, and we'll basically send it through a cloud portal to the dental laboratory so they can start making our restorations. And depending on the laboratory, it takes them about 3 to 4 weeks to make these uh, really pretty restorations. I think of these as little pieces of art. And this is just a black and white photo of the veneers and crowns. And you can appreciate a little bit more the texture that natural teeth have. And I think that's an important part of making teeth look natural, is making sure that you're recreating the proper anatomy in those teeth. And I like to take artsy photos of sometimes of these restorations if they're really well done. These were very well done because, like I said, these are little pieces of art. So they're kind of neat to get creative with some of the photography. And then here was the case put into the patient's mouth. This is directly after we bonded them in. You can see the gum tissue is still a little angry, and that's pretty common. We have to make sure that we don't leave any cement or dental glue behind that will irritate the gum tissue. And then we bring the patient back a few weeks later to make sure that everything's okay. And this was the final outcome that we had after the patient's gum tissue had healed. She was very, very happy. You can see how well these veneers and crowns blend in with the natural tooth structure, and that's due to the fact that we used a good dental lab. And here it is. This is where we started, just as a reminder. And I like to get fun. I like to have fun with the patient. I like to bring them in, tell them to dress up, wear lipstick. We have kind of a little photo shoot to celebrate the end of the case, and I think that's kind of a neat way to include the patient. You can send them the photos so they have them, and I don't know what they do with them if they're even interested in it, but I think it's kind of a fun way to celebrate the end of a case because in the end these cases do cost the patient quite a bit of money. And it takes them quite a bit of time as well. So it's nice to have a little bit of a celebration. And this is the camera setup that I use. It looks a little intimidating when it's coming at you, but and I spent a couple $1,000s on this setup, but I use it every single day because I love to take pictures, and we use it for all different sorts of things. Well, what kind of things would we use dental photography for? Well, I already told you to take pictures of your work to make sure that you can see things that you've done well and things that you haven't done well. The other thing is a tool for laboratory communication, and this is a set of pictures that I sent to a laboratory showing, we talked about the fact that we want that line going down the middle of the patient's face to go right through the middle of those two central incisors. What you can appreciate in that photo on the right is that when the laboratory made this bridge, and this was a bridge on two implants, they made it crooked, right? And so I wanted to relay that information to the laboratory. And so taking two photos side by side is a good way to do that so that they can remake that bridge and make sure that they get that midline right on. The other thing I use it for is patient communication. So we'll take pictures of patients' teeth and we'll come up with a plan for their treatment. And often I will kind of do things like this where I will type little notes on the patient's pictures just to give them an idea of what we need to do and why we need to do it. And I think this is a good visual way of making sure the patient is on board with their treatment and understands the reasons why their teeth need to be worked on, because it's kind of a big deal. You know, if you get a filling done, if you get a crown placed, if you get, veneers, you want to make sure the patient understands why they need to get that work done. And then there's the artsy part of it, taking portraits. I really like to take portraits. I think it's kind of a neat thing. I was inspired by one of my coworkers, a guy named Adamo Notre Antonio, who takes just kind of the coolest pictures. He will spend all day doing makeup and getting his models ready to take a couple hundred photos to just get the neatest shots. And I think I was kind of inspired by that level of creativity. I think that's really cool. Once again, not for everybody. It just depends on the kind of stuff you're into. Well, I hope you learned a little bit from this. I appreciate you joining me. Once again, dentistry is a really neat career, and you can do dentistry a lot of different ways. The way that I do dentistry is probably quite a bit different than the way others do it. There's nothing wrong with that. It just depends on what your philosophies are and what you have fun doing. So I appreciate you joining me. I am on Instagram if you want to see some cool stuff. If you get as you move into dental school, Smile Professor is my handle. So appreciate you joining me.